Hello, I'm Dr. John with Gonstead Physical Medicine, and today we're going to talk about what the root cause of your problem is from cervical disc displacement. Now, what is cervical disc displacement? That's when you have a protruded disc, a bulging disc, a herniated disc, and an extruded disc. These are serious injuries and they should be treated as soon as possible. And they usually present as neck pain that may travel down to the arm and down to the hands with tingling and numbness. Now, what does this look like on the model of the spine? Well, here's a typical model of the spine. You have two vertebrae, you have the disc. Right through here is an opening called the neural canal where the spinal cord goes through. And this portion of the spine is called the neural foramina where the nerves exit the spine. Now, the disc is compared to a jelly donut, and that's right, a jelly donut. And the reason why is because the inner material is a gelatinous substance called the nucleus pulposus. And the outside is a strong fiber or fibers, as you can see through here, that's called the annulus fibrosus. Now, what happens with disc displacement is that the annulus fibers start to weaken from the inside out, usually from a trauma to the spine or a repetitive stress. So once that starts happening and the fibers start to weaken, that inner material of the nucleus starts to actually displace. And as soon as it displaces, that is called a disc protrusion. And as that protrusion or that displacement gets larger, that's called a disc bulge. Now, the story continues. When that bulge gets larger and starts pushing into the spinal cord region and can't go any further, that's called a disc herniation. And what could happen after the disc herniation is that the disc could actually rip, and that's called a disc extrusion. Those are serious injuries and should be treated as soon as possible. So I want to show you what this looks like on the model. You can see that that starts to bulge and that's starting to move, that's starting to protrude. Now, when the protrusion is greater than 25% of the circumference of the disc, that's considered a disc bulge. When it gets larger and it starts pushing into the spinal canal area, that's called a herniation. And then when the disc rips, that's called a disc extrusion. Now, let me show you what this looks like on a chart. So this is a normal disc, and you can see the nucleus is all contained. This is the nucleus pulposus. And out here is called the, like I said before, the annulus fibrosus. And then when the disc bulges or protrudes or herniates, you can see the whole disc starts to change shape. And once that starts happening, it puts pressure on the nerve and it creates a lot of pain. Okay. Having said that, the best way to determine disc displacement is the imaging of choice is the MRI. The MRI will show the soft tissue really well. So I have an MRI of a patient up here right now. This is the anterior of the spine. This is the posterior of the spine. And this is the spinal canal right through here. As I said, these are the vertebrae of the spine through here, and then between the vertebrae are the spinal discs. Now, when we come down here, you can see that this disc, which is the shock absorber of the spine, is contained within the vertebra. And as we move up, you can see this one through here is bulging to the anterior. And as we go up again, you can see this disc is bulging to the anterior, and it's also pushing into the spinal canal region. Like I said before, they're serious injuries and they should be treated as soon as possible. I'm Dr. John with Gonstead Physical Medicine. It was a pleasure doing this video for you, and I look forward to seeing you in the next video.